Hello, and welcome to our master's class, Extractions: What, Why, When, Where, and How. I get a lot of questions about extractions, and it's important that we understand the importance of the extractions throughout the process of providing our services to our clients. Most facials are really designed to be relaxing or luxuriant and painless. They involve a lot of steam, exfoliating, and gentle massage, and most skincare practitioners can perform that very well. Clinical facials, however, are a slightly different story. They can be slightly uncomfortable and that they require a higher level of expertise. The difference in the extractions and the tools that you use are really critical. What are extractions? I believe they're a necessary step within the facial for the purpose of drawing out pore clogging sebum using a precise technique and gentle pressure without scarring or tearing the skin at all. With luck, the plug of the sebaceous matter is coaxed from the pore gently. Not only do extractions immediately improve the look of the skin, especially if the blackhead is very large and obvious, but when done regularly, they can really help reduce the breakouts. When do we extract and when not to extract? First of all, please understand your state regulations when it comes to extractions. Some states allow tools while others don't. Some allow lancets while others don't. And for the sake of this webinar, we're not going to discuss using lancets at all. We'll be discussing performing extractions manually with a tool or with our fingertips. Always protect yourself with gloves and masks if necessary. Why are extractions important? Really, the goal is to leave the skin feeling clean, clear, and healthy. Facials that don't include extractions will not accomplish this goal. If the filament remains inside of the pores, bacteria festers and acne lesions could occur. Remember that most clients' home care regimens do very little to the depth of the pores. They can be very proficient in superficially cleaning the skin, but entering the pores and cleaning out the filament is critical to clear skin. Remember that pores openings can be permanently stretched by the clogging matter if not removed. As comedones are full of acids and bacteria and other material, such as dead skin cells, scarring could be the end result if left untreated. There's no doubt that extractions can be a major ally in the quest for clear, healthy, smooth skin. Getting that sebum out of the pore can also flatten bumps, reduce irritation, and make the pores appear smaller. So what can we extract? Remember that in the scope of practice for an esthetician in most states, we can really treat grades 1 through 3 acne. That means that we're not touching a grade 4 nodular or cystic type acne. It's also critical to know that when not using lancets, how we really get those closed comedones or those closed pustules out of the skin. I'm going to share with you a couple ideas and extraction techniques that may help. This illustration shows the 4 different types of pustules or pustures. The first one here is a closed comedone. You can see that it's completely closed with filament over the top. These need a little bit more coaxing to come out. Closed comedones could be as a result of a very refined pore opening or a very clogged pore that's oxidized. The illustration next is of an open comedone. To your right here, you can see that there's clearly an evacuation area in which we could coax the filament out from. The third is an illustration of a papule. The papules, when we start to see some inflammation in the lower dermis, we also see some expansion of the follicular opening that could cause some irritation, and we're starting to see some pus formation. In the illustration of the pustule here, we see an exaggeration of pus formation within the tissue. So we have a closed comedone, which is a plug that stays under the skin and appears like a little white bump, commonly called a whitehead. Also can, in some cases, be mistaken for milia. Open comedones are the plug that reaches the skin surface and actually opens up. It may look a little black on the surface. This is through oxidation. Papules are small pink bumps on the skin surface that may be a little tender when touched. You can actually feel the heat sometimes. We also call these inflamed comedones. And then we have pustules. These are the red skin bumps filled with yellow or white pus, commonly called pimples. And then we have the grade 4, which is the cysts. These are pus-filled sores that can be deep, painful, and can cause scarring if left untreated. These, however, are outside the scope of our practice, and we need to refer these types of clients' conditions to a dermatologist for removal. These are some illustrations to help also appreciate what we're looking at here. The open comedones here look like little specks of dirt. These are sometimes very aged and difficult to coax out of the skin. We'll talk about some remedies for that. And then you have the closed comedones, which are these tiny little whiteheads. These can be very difficult to extract as well. We have the inflammatory papule, the beginning of some inflammation, and then we have the pustule where we actually see pus present in the lesion. So when should we extract? Really only when a prominent open lesion is present. We don't want to coax too much pressure. We can spread bacterial throughout the tissue itself. We can spread laterally throughout the tissue or pore to pore, and so we want to eliminate that in most cases. Prepping the skin is mandatory in order to soften the filament and for less trauma to the skin, and it helps to liquefy the filament so it's easily extracted. When shouldn't we extract? Again, this is your grade 4 cystic or nodular cystic acne. These are very difficult to treat within the scope of aesthetics and should be referred to a dermatologist for treatment. How do we extract properly? Well, there's two direct ways to extract. They do require some skill and patience, and also it requires practice. So practice makes perfect with extractions. We're going to talk about the finger or tool placement, appropriate pressure, and squeezing techniques to be polished in order to successfully extract. Again, we're going to focus on the two methods here, one being manually with your fingers and one being with a tool. Make sure you're properly prepared for extractions. You want to have all your supplies handy and ready to go and on your cart. Absolutely, gloves should be worn as a mandated policy throughout any extractions. 4x4s, your extraction tool if desired, Q-tips to help dab. The pre-squeeze extraction serum is critical in the protocol for extraction. The Fix-It, which is our salicylic acid 2%, which is, again, part of the protocol to create the antimicrobial environment. And then the process itself, you want to first analyze the skin and create a plan. When I talk about creating a plan, it's about working in quadrants throughout the face and working on small areas at a time and migrating around the face to give equal parts of the face equal extraction time. We want to make sure that you, after create your plan, that you prep the skin appropriately. Prepping can involve everything from steam, warm towels, enzymes, in some cases, the pumpkin, or the pre-squeeze as a standalone, or the pre-squeeze underneath the pumpkin to help marinate the skin if you're working on very difficult comedones to extract. And then we want to execute the process. So again, create a plan first, execute the process. Making sure, again, you're properly preparing the skin before beginning extractions, softening the debris in the pores as much as possible prior to extractions, avoids trauma on the skin, and actually can make it a little bit more palatable for the client. Make sure we protect the client's eyes from the mag lamp, sometimes with eye pads or eye goggles with pads underneath to make sure they're comfortable, just so the glaringness of the mag lamp is not in their eyes. We recommend the Peel Away the Years Pumpkin Mask or the Senzyme Duo to be applied for 7 to 10 minutes with steam to soften the filament. Again, if you're working on very difficult comedones or closed pustules, or papules, then what we want to do is put the pre-squeeze on underneath the Peel Away the Years or underneath the Senzyme and use that to continue softening the skin, and then again apply it throughout the extraction process. So once we remove the Peel Away the Years or the Senzyme, and completely clean it from the skin. You'll apply either a pre-squeeze to the area that you're extracting, or you'll apply it again if you've previously used it underneath the peel over the ears or the Senzyme. Leave that on for 1 minute. Now, there's two things to look at. We want to make sure that we keep the skin moist throughout extractions. And so you may need to add additional layers or additional applications of the pre-squeeze when needed. Or take your vitamin spray is great to keep the skin moist. There's two things to think about also with the pre-squeeze. If you're using your fingertip methods, you want to make sure you remove or wipe away the pre-squeeze from the area that you're extracting in that quadrant so that avoids any slippage. If you're using the tool, it actually works to keep it on the skin so you can glide the tool or scale with the tool without causing any trauma to the skin. But keep the Take Your Vitamin spray handy, and you can spritz throughout the process. You don't want the skin to dry out as it becomes pretty resistant then to the extraction process. Again, there are different methods of extractions. The first two that I'm going to talk about are actually manual methods with your fingertips. The first is called what I call the squeeze technique. The squeeze technique is just coming in from both sides of the lesion on an open comedone and really coaxing out the filament. This should be done with ease. If there's more needed, there's what we call the wiggle technique. And that's, again, coming at the lesion on both sides and actually wiggling your fingertips to coax the filament out of the pore. So squeezing is one way. If it becomes resistant, then we can use the wiggle technique manually to coax out the filament. The next two are really done with the tool. The scooping technique is done with the loop on your comedone extractor to scoop out the filament in some of your more grade 3 pustular acne lesions, as well as the open comedones. And then the scaling technique is when you use that tool on its side and you leave the pre-squeeze on the skin and keep the skin very moist, and you literally scale over the pores, and you'll see after 1 minute of the pre-squeeze being on the skin that you're going to see the filament really come out with ease. So these are the 4 techniques that I teach. Again, the squeeze and the wiggle techniques are done manually. The scooping and the scaling techniques are done with your comedone extractor, keeping the skin moist. Sometimes extractions can go bad. When this service is done correctly by a professional in a sterile environment, it's fairly safe. It's when it starts to be done at home or when we have carelessness or recklessness in the treatment room, we can cause some havoc. Acne extractions can quickly clear up unsightly acne and prevent future breakouts. And so it makes for a great preventative service and also corrective for those suffering from a current or chronic acne condition. If acne extractions are not professionally handled, some serious risks can be involved. For instance, if such pressure is too firm or in the wrong direction, we can lead to what I call a lateral bacterial infection of the skin when we're moving around that infection. It can absolutely increase irritation within the tissue. We can see more distension or dilation of the capillary structure, which will appear to look reddened or ruddy on the surface of the skin. And we can see additional acne problems occur over the length of time when inappropriate or not proper extractions are being done. In the worst case scenario, inappropriate extraction can even cause infection and scarring. I've seen a lot of scarring from the tool when used inappropriately. Poorly performed extractions can also be pretty painful. So when done correctly, extractions may be a little uncomfortable, but shouldn't really hurt. So again, when we look back, it's really all in how we prep the skin and what solutions we use as far as techniques, and then how we care for the skin afterwards. The goal is to not elicit too much irritation or redness or pain. When the extractions go wrong, we can see that it may lead to some real damage underneath. Here we're looking at a closed hair follicle with a little bit of a closed comedone here. When you squeeze an infective lesion, you create pressure that can spread the infection. You can see in this next illustration how that's starting to happen. We can actually burst the follicular lining, and that's where we see a lateral infection begin. The next is if you have infection that bursts above and below the skin. So again, you're cross-contaminating the surface pore to pore, and you're getting bursting of the infectious material below. So we're getting quite a wide spread of the infection here. We know that this enlarges the pore opening, and the infection can cause some increased scarring when left alone or left untreated. We know that the spread of bacteria can also affect the onset of white blood cells, which rescue the area and start to fix the skin, if you will. And because they don't know when to stop fixing, these agents can also cause some collateral damage, which is why we see some scarring. When the damage is severe enough, scar tissue forms, which appears as a depression or what's known as a pit scarring in the surface of the skin. So we want to eliminate this at all times. So evacuate the pore the best that you can. And as a follow-up, we recommend just dabbing on amount of the Fix-It, which is the 2% salicylic acid. This is going to ensure that you've created the antimicrobial environment to prevent the spread of that bacteria. Scarring is a long-term effect of acne and may look uneven in the skin surface, or in some cases cause some skin tones or discoloration. I love using this picture. It's taken from Dr. Jeffrey Dover here in Newport Beach, California, and he actually shows this great when he had a patient that did her own extractions at home with a tool. You can actually see the outline of the tool here in a close-up. So although we don't advocate that the clients extract at home, we're working towards a mini-series or mini extraction services where they can come in quickly and have extractions done by the professional instead of causing this kind of damage at home. This is also could be a result of leaving those unwanted lesions unattended in the skin and causing that collateral damage. So how much should we extract per visit? I'm asked this quite a bit. Again, if you have a plan, then decide how many treatments it's going to take to successfully extract. And don't try to extract everything in one session. If you do, discuss it with the client because they might not want more extractions than 10 minutes in that service. We do have clients that really need more extraction time. Therefore, if you had to eliminate something in the step of your protocol, it would be the massage step. Although massage can really be good at liquefying the filament with steam, that would be one area that you could cut back. But again, remember that multiple sessions might be necessary, and in most cases with severe clogging or congesting in the skin, that we recommend that as opposed to extracting too much too soon in one session. I really would like to stick to the 10 minutes per facial. But again, like I said, you can cut back on massage time. And in some cases with inflamed acne, massage can be eliminated altogether as it's not good to encourage more inflammation or stimulation in those skin conditions. And remember the follow-up care, again, the Fix-It. Applied with a cotton tip applicator just to the area in which you've extracted, it's going to help seal up and promote the healing. It's going to stop any exudate or any clear fluid that's coming out of the pore. It will disinfect the area, tighten up the appearance of the pore, and automatically reduce inflammation. Now remember, your clients will feel a pretty good buzz on an open lesion with the Fix-It, so make sure that you're letting them know what to expect, and some may just opt out of that instead. So in the real sensitive skin types, it may not be a good fit. But in most cases, if you're doing quite a bit of extraction, this is a really great way to follow up. Remember to finish the treatment off with a cooling, soothing, anti-inflammatory mask. And in ClearDRX case, the cold compress or the Rise and Shine are really good choices for that. Thank you so much for joining our master's class today. As always, make sure you contact us if we can be of any support, and also follow us on all of our social media as we post lots of educational things on our social media platforms. Thanks again and have a great day.